Hello and welcome again to this edition of Phi TV, a product of Florida Internet and Television, the industry that connects and entertains almost 95% of all Floridians. I'm your host, Brad Swanson, and once again, we're joined by our good friend, Emmett Reed of the Florida Healthcare Association. Welcome back to the program.
Thanks, Brad. It is always great to be here.
All right, well, so we've just started the legislative session 2023. Ron DeSantis, governor, great Speaker of the House, and Paul Renner, fantastic president, and Kathleen Passidomo. Tell us a little bit about your association and kind of, what's your role here in the legislature?
Sure. It's a great question. We represent 605 of the skilled nursing facilities, nursing homes in the state of Florida. There are only 700 in the state. Right now we represent 605. Of course, we want to get to that 700 number eventually, and we'll get there. We also represent assisted living facilities. So the long-term care space is where we operate. We advocate for the owners of nursing homes as well as the employees and the residents. I mean, it's kind of the whole package.
Yeah, I mean, you've been on the program many times talking about the ins and outs and hurricane care and all sorts of just amazing stuff. What's tops on your issue this year? And I assume could be something every year.
Yeah, well, I tell you, it's a toss-up between funding and another issue, which I can talk about later. But I think funding is probably what you've heard a lot from us.
Of course.
And I know that the legislature says, when are you guys going to stop asking us for funding?
Well, how does that work? It's not a grant. I mean, how does the funding work?
Right. So in nursing homes, there are three primary sources of funding, really two: Medicaid and Medicare. Again, Medicaid, if you think of it, is for folks with less resources. Medicare is the federal funding. So Medicaid's the state piece that we're talking about here in the state of Florida. Of course, then there's private pay and insurance, but that's a very small portion of the folks, the residents in a nursing home. So that's how we are funded. Okay. So the state of Florida is our biggest partner.
Okay. All right. So as you go to the state, and obviously it's the legislative process, how does that work? Is it an appropriation, and what's the effort that goes into securing that funding?
Well, the effort, first of all, is proving to the legislature that these funds are necessary. But I'm just going to give you a great example I think you'll find very interesting. Right now, the average Medicaid rate, the state of Florida rate, for a nursing home resident is $253 a day. Now, what hotel in Tallahassee can you stay for $253 a day, get fed, get your medication, have 24-hour care from a nurse? I mean, it's impossible, right? And so that's the system that we're working under. And so we're grateful for the funding, but it's just expensive to take care of Florida's frail and elderly.
And the bulk of seniors that are in the care of your members are on Medicaid. Is that what you're saying?
Yes. The major.
So this is the major dollars that this is what cares for those Florida people.
Correct.
Okay, so when we think about that care, and you think about they're out there doing that, when do you know you've reached the goal of that number? And what? Well, actually, I guess a better question is well, that might be what Medicaid pays. What's the What's the number that's unsubsidized?
Yeah, it varies, but it's we definitely have to right now subsidize it with the Medicare payment because the Medicare payment's a little bit higher, but you have fewer residents. So the margins are razor thin in nursing homes. And so I think the real question is, I think a fair question is, when do you stop coming to the trough and asking for funding? And the answer is, well, it's not really that simple, but if we were to get the rate increase we're asking for this year, and then inflation built into the rates every year, then I think we would be okay. I think we wouldn't have to come back and ask year in and year out. But I know that it gets a little tiring, but I will tell you, it's worth fighting for those frail and elderly in Florida.
Well, and I think one of the things, and we've known each other for a long time, and we love advocating for our members, but you kind of have some programs that are kind of the envy of the rest of us that are in this association business. Tell us how you bring your members to the Capitol and how do you engage them in the process?
Yeah, this is so exciting. So we have a program called Lobby Wednesdays, and we believe that if it's important enough for it to be on our priority list, it's important enough for our members to show up to the Capitol each and every week. So we're going to have close to 500 members coming every single week starting next week to the Capitol. They come in for a briefing. It's all business. We come in for a briefing, have breakfast, they're making their appointments now, or whenever they're allowed to. There's now a 48-hour House rule that I believe you have to make your appointment. So they're going to be making their appointments whenever they can, coming up here and marching on the Capitol, advocating for their residents.
So let's take it from the other perspective. When you meet with legislators and you ask them, hey, are you hearing our story? Are we telling our story in a way you can receive it? What's their reaction to your members coming to Tallahassee?
Well, they love it. They want to talk to the people on the front line, the people that are being affected by their policies, by their funding decisions. And by the way, the Florida legislature has been phenomenal. Last year, incredible funding for nursing homes. They're listening, they're hearing, and they're acting. So they've been great to work with again. But it's incumbent upon us to make sure that we're proving to them that we need what we're asking for.
Yeah. Before we move on to a second subject, we've recently had some hurricanes in the state of Florida, and we've been on telling the story of how you care for these elderly. How did your members fare through Ian?
I'll tell you, we lost some nursing homes. We had lots of evacuations. I think we had something like 75, maybe between 75 and 80 evacuations. And understand, when you're evacuating...
People or nursing homes?
Nursing homes. Okay. Nursing homes, not people.
Whoa.
The entire nursing home, 120 residents, the staff, all moving to safe places. There's something called transfer trauma. Mm-hmm. It's very dangerous to move frail and elderly people.
Sure.
We had 0 deaths, thank God. And that's also a great attribute to the employees that work in those skilled nursing centers and how much they care for the residents.
Well, thank goodness. We just haven't had you on in a minute, so I was hoping
Can I say one more thing about that?
Of
because
course.
you led me this. Our association also raised money to help CNAs that needed, that lost, whether they lost power and lost their food or lost their car. We're able to raise close to $200,000 for these CNAs and nurses affected in a nursing home. We were able to give out 900 checks.
Fantastic.
Yeah, so we're so happy to do that.
Well, it's a big association. It's so much bigger than just your facility in Tallahassee, and it really extends. I've had the pleasure of meeting with your members and just talking a little communications, kind of some of the stuff we do, but the real pleasure of doing that was I got to see the people that are at the heart of these organizations caring for Florida's elderly. Okay, so we were on workforce, or we're about to get on workforce, which seems to be that and workforce housing. But tell us what's going on in your workforce, Billy. We always talk about how we need more nurses and things like that. What are you guys working on this year?
Well, we are working on a great bill called the Qualified Medication Assistant Bill. Mm-hmm. And the bill is actually Senator Colleen Burton and Representative Will Robinson are working. They each have bills that have come up with a great idea. The qualified medication aid is this. It allows a certified nursing assistant that's been in a facility working there for 1 year and takes a 40-hour course. They will be allowed to pass routine medications, non-narcotics medications. They're not going to be able to pass injections. So if you've got to hand out Tylenol or something like that, they'll be allowed to do that. Right now, nurses are doing that. That takes the nurses away from doing what they're really good at, which is nursing. Right. And so the certified nursing assistant will be given that additional responsibility. It'll also be a step up. It's a widely supported bill, supported by AARP, the Florida Medical Directors Association, the National Certified Nursing Association. So this bill is a good bill. They already do this in 36 other states. It's time for Florida to get on board.
It's a really fascinating conversation when you think about just that topic. Like, it sounds so simple, like just get grandma her Tylenol. But when you think about scope of care and what Florida's laws and how they protect the citizens of Florida by who's trained to do what, and the scope of care that a license gives you is fascinating. And what doctors are allowed to do, and I know nurses and super trained nurses like anesthesiologist type nurses, and what they can do and the breadth of what they can do. And you think, wow, that all comes down to who can hand out Tylenol and regular medications to these seniors, and you would think, oh, that's easy. Like it should be anybody, but it's not, because obviously they still need to have skill and care, and the 40-hour course is there. So you feeling good about that? And
I think that's a really popular bill. I think everybody, look, it's like a representative from AARP said that day, when AARP and the Florida Healthcare Association agree with something, it's a pretty good bill.
Yeah, for sure. And our good friend Jeff Johnson over there does a fantastic job at AARP. All right, so let's go, in our last 3 minutes, we've got So we've got a governor, we've got a fantastic legislature, but they are leaning into the tort issue with gusto, right? And we haven't really seen this sort of pushback against the Florida, the trial lawyers and their advocacy association. What's happening in this space for you?
So Representative Randy Maggard and Senator Colleen Burton, again, have a couple tort bills of interest to the nursing home field. And essentially, there's a lot of protections. And right now, lawsuits are suffocating nursing homes. I mean, so think about this. We talked about funding. It's all connected. We talked about funding. The lawmakers are asking, well, what are you doing with those funds? Well, part of those funds are going into the trial attorneys' pockets because they're coming in and forcing settlements. The billboard attorneys are coming all out of the woodwork trying to sue nursing homes. And one in particular egregious way that this happens is adult children come and sue for non-economic damages, for pain and suffering. So think about this. If somebody passes
the adult children of the person that passes away are suing
many
for
of them never coming into
suffering.
the nursing home to visit their parent, by the way. That happens many, many times. Never in another state, they don't come and see them. Parent dies, billboard attorney gets a hold of them, and they come in and basically try to sue the nursing home for non-economic damages. Now, hear me clearly. The estate can still sue a nursing home if they think something was afoot.
Sure, of course.
That child should benefit from that estate eventually.
Right.
So really what you got is double dipping on that money as well.
Well, there's a reason why Florida is currently ranked, 48th worst in the country for litigiousness. It's why if you're a billboard attorney, it's third best.
That's right.
So it's all perspective.
Right.
All right. Well, Emmett, thanks for coming on and sharing these important issues you're working on, telling the story about the care that your members give. It's always fantastic. You're in the Capitol nonstop, and it's always fun to see how you tell your members' story and the good work that your members do. So we appreciate that. That's all the time we have for this one, buddy, but appreciate you coming on.
Thanks, Brad. Appreciate you.
Thank you. It's all the time we have for this episode of Phi TV. Make sure you hit us up on our social media feeds for more interviews like this one. And for now, thanks for tuning in.